Good morning, everyone. It's a pleasure to be here amongst you. I appreciate the invitation. Thank you for reaching out, and it's an honor to present to the group. This is a group that I have been a member of for a very, very long time. The chapter is really, really dear to my heart. Despite the fact that since COVID, we all sort of became, we sat home and I haven't been involved anymore, but I'm hoping that this will be a beginning of a new journey for me too. So let me tell you a little bit about myself, and I will start sharing my is part of the slides that I am presenting. So let me know if all of you guys can see my slides and can hear me comfortably. And I'm hoping that the captionist can hear me good too. If you have any questions and they are pertinent, please feel free to raise your hands. And I think Tim or Wendy are mending the chat. If the question is not very, very hot and you can wait till the end of the presentation, then we will answer the question at the end. A little bit about me. I have both a master's degree in audiology and an AUD. So when I started on my journey, practicing with the master's degree. But by the time that I started doing all the research, I came back. So I took a mommy leave of absence from 2004 to, I think it was 2006, 5, for about a year to raise my son, who was very colicky. When I came back, I figured, like, you know what, I need more information, I need more research. So that's when I went after my AUD. And since between when I started and when my daughter was born and life interfered, and finally AUD got finished in 2013, which it's hard to believe it's 10 years ago. I have always been involved in audiology, even when I was acting as a mommy. I did a lot of medical legal research. I have been a big advocate for hearing loss, either one, because now we live in the edge of technology and both of them have solutions. So I'm involved with Board of American Academy of Audiology and American Tinnitus Association. I have two practices, Hearing Loss Solutions and Auditory Processing Centers, which they are both corporations registered in California. I have represented a manufacturer by the name of Synchra, which was a German company, the first neuromodulation therapy device for tinnitus, which unfortunately went bankrupt during COVID. So I have many, many years of clinical experience with tinnitus, as well as I have been a patient with tinnitus myself. Tinnitus runs genetically in our family. My mom is me, and then now my son who has it. But I gotta tell you, none of us are suffering from tinnitus because we all have learned and we all have been dealing with tinnitus, and really it's not a bother to any one of us. In giving you disclosures, I currently serve on the executive board of American Tinnitus Association as the assistant treasurer. And I take phone calls for Tinnitus Advisors Program, which I'm going to talk about. It's one of the proudest things that I do. It's because we take phone calls from everywhere in US, Canada, the world actually, for people who are in distress and they don't know what to do with their tinnitus. So ATA is sponsoring this 10 app hotline, which I will give you the information. So with all that, I think it's safe to start. If you guys are ready, I think we're 8 minutes into it. Wendy, do you want to wait, or you guys want to start? I'm assuming we're good to go. Okay, so one thing about tinnitus, I'm going to just give general information here. The devices that we talk about, all are technology. The success of the device depends on the patient and on the clinician. And you need to know that no two tinnitus patients are the same way as no two hearing loss patients are the same. The outcomes are highly, highly variable depending on the patient's presentations, the relationship between the hearing loss and the tinnitus, variation in perception of the tinnitus, variations in the reaction of the patient to tinnitus, and the variation in the pathophysiology of the tinnitus. So I want you to know that the information presented here are my personal opinion as a clinician, has nothing to do with what ATA stands for. Okay, so I think one of the major questions is that why does it seem like there is no one trained in treatment of tinnitus? It's like you go to, usually people's first choice is to go to their physician. And most often they hear that, hey, there is nothing to do with it, learn to live with it. And that statement is absolutely not true. Where does that statement come from? Unfortunately, is from lack of information on the ENT side and the physician side. Most of them are not interested in learning things that do not generate income. So basically, tinnitus has become a category which is only interesting to those of us who are in love with it and have dedicated our lives to it. The other thing is that medicine, especially physicians, deal with things which are black or white. Either you have the disease or you don't have the disease. Either you need a surgery or you do not need the surgery. Either your medication can work for you or the medication doesn't work. And tinnitus is not black and white. It's very, very gray. So that's one of the reasons. Tinnitus requires patients that you only get it from a physician if you need surgery. ENTs in medical school only get possibly a lesson or two about tinnitus because there's no surgery. So the surgeons usually do not even get any lessons about it. Hearing aid dispensers are not supposed to touch tinnitus cases, especially in the state of California. That's an area which American Academy of Association stands for very strongly, because as you know, hearing aid dispensers, yeah, some of them are very well educated, but some of them just have a high school degree and their certificate. So we basically, because tinnitus could be a sign of so many other medical disorders, we really don't want anyone who does not have a doctorate degree to touch it. Now, why not all audiologists know about it? Because audiology is growing. Of us the schools basically are trying to churn as many audiologists as possible. So not everybody is trained in tinnitus because simply there is no time. Despite the fact that now audiology has become a 4-year curriculum, still it's not enough time to work on everything. So most education about tinnitus is postgraduate and it's not specific. So many of us who have dedicated our lives to tinnitus, we are pushing now for certification and special training. So if we want to talk about who can treat tinnitus, I would tell you, look for audiologists who have board certification with CHTM, which stands for Certificate Holder Tinnitus Management. That's basically the simplest way that an audiologist can tell you that I care enough about 6-month period learning about it. It doesn't guarantee that the person is abreast of all the information and knowledge coming out. It doesn't mean anything, but it's a beginning. So we're beginning to enforce this. So let's get into treatment of tinnitus. Everybody who knows me that I like general categorizations because I think it gives us a way that we can process information more clearly. So one way to categorize tinnitus treatments is the ones which are aimed at directly reducing the intensity of tinnitus, what the patient perceives. And there are the ones which are aimed at relieving the annoyance which is associated with tinnitus. So, and in both of them, so when we talk about annoyance is how much tinnitus perceives caps the person's life and their quality of life. When we talk about reducing the intensity, we're talking about reducing the loudness of the tinnitus. So I'm going to break this down, but these are the two general categories. As you can see, there are devices which are going to be common between category 1 and category 2, and those are medications. And some medications, basically, these are some psych medications that we use in therapy now. And basically, they are geared toward if the patient is not paying attention to the tinnitus, then it doesn't give the tinnitus an option to increase volume. And then we have electrical devices, which I'm going to review with you right now. Then the other way to actually talk about different treatment categories of psychological treatments, instruments that we use, and acoustic options, which basically we talk about all sort of sounds that we use in treatment of tinnitus. Usually, if we want to talk about psychological, so I'm going to go through things separate, but if we want to talk about the psychological options, basically these are the options that the patient can work on her own behavior and the responses that she or he produces in perception of tinnitus. When we talk about instruments, we're talking about things which have gained FDA regulations in treatment of tinnitus. And then we talk about acoustic options are things which are available through musical therapy being used in treatment of tinnitus. So let's get into it. I have to get, as a scientist, I have to tell you, when you do research, cognitive behavior therapy, CBT, is one of the major improvements shows major improvement in life of a patient who is suffering from tinnitus. And it's because our friends in psych have helped us deal with our patients because we don't have too many audiologists. So in recent years, there are not that many psychologists who want to do CBT anymore, especially for tinnitus. So this is falling back on audiologists who are getting trained in CBT. So we have started using a modified version for this because, again, CBT belongs to psychologists. And this is like something that I use in my practice as well because my sister is a psychologist who is trained in CBT. So if there is a CBT therapist that we work with, usually the audiologist is the lead and the CBT therapist is the one who works closely with us, helping us in management of the tinnitus. Then we have TRT, which is tinnitus retraining therapy, progressive tinnitus management, and tinnitus activities treatment, which all of three are basically based on behavioral modification, which is, again, it's based on CBT. So let's talk about each one of this. So this one just talks about two of my very dear friends who do CBT specifically, two psychologists. They have online programs. You can reach to them if you want. Let's get into tinnitus retraining therapy. TRT is the most widely used tinnitus therapy in most practices. It's started by Professor Jastroboff and his wife. It talks about education and modification in responses to tinnitus, which basically effectively causes habituations. When we talk about the Jastroboffs, it's a neurophysiological model, which it's a husband and wife team. They have worked and they have done research. They have dedicated their life to TRT, and most people like me, we use a TRT not in a traditional concept, rather in some form, shape that would benefit the patient. So basically, TRT is about education of the patient, bringing light into disassociation of the negative emotion, decreasing the emotional negativity towards tinnitus, and increasing the emphasis on relaxation and pleasure centers of the brain. We basically encourage habituation. In TRT, we usually use some sort of relaxation therapy in addition to sound maskers in order to be able to help the patient to transition. TRT, you got to make sure whoever is telling you that they know what to do, they actually are trained and they have a signature certification by both doctors Jastroboffs. So do not suffice, because we know that there are people out there who just say, oh, I'm trained in TRT. I would say if you go somewhere, most of us who are trained in TRT, we have our certifications actually on the wall. Progressive tinnitus management is another behavioral modification towards tinnitus. This is by James Henry, who is a dear friend. And basically, it's management of reactions to tinnitus. PTM is it's used in VA method for therapy. VA is Dr. Jastroboff, Dr. James Henry, basically, and Jastroboff have worked very closely with each other in the beginning in development of this. Basically, it's, again, based on the same neurophysiological model, detangling tinnitus from the negativity associated with it. Dr. Henry has dedicated his life to VA. Pretty much that's a setting that he has always been in, and he has been very, very successful with treatment of it. PTM has the stages. Usually the patients start from the lower stage, which is a consultation, and then it moves all the way to the 5th stage, which basically they work directly with a psychologist in treatment of negativity and what affects their quality of life negatively about tinnitus perception. Usually in this model, there is, on the level of 1st and 2nd, audiologists get involved in order to make sure there is what is the degree of hearing loss and what is the relationship of the tinnitus loudness to the hearing loss. Tinnitus activities treatment, which is, for short, we all call it TAT. Again, it's another behavioral modification, but this one has a specific scenarios. Basically, patients are given homeworks and they come up with the specific problems that they have with their tinnitus perception. TAT, actually, it's wonderful. They offer a lot of sessions online, group sessions. And if anybody is interested in this, please reach out to my office and we'll give you details Um, um, they actually have once a year from University of Idaho sessions that everybody can join. Audiologists, sufferers, everybody joins, and basically we talk about treatment. Patients talk about the newest things that they have tried, and a lot of scientists actually present in this group. So if you guys are interested, please let me know and we'll put you in touch with this group. Then there is a neuromodulation therapy. So this development in tinnitus that we are using currently in most practices. Neuromodulation basically means, sort of, if you want to put it in layman's term, it's deep massaging the brain in a way that we cause we help the brain to have more stimulations in order to let go of one overactive location in the brain, which is the tinnitus perception. So by causing the other areas of the brain, stimulating the other areas of the brain, we basically tell the brain, don't pay attention to this. And then whatever overactivity we have here, we try to decrease it by opening up other locations. So the way that we talk about neuromodulation usually is by saying, because of the tinnitus perception, we're opening outlets from the other areas so the tinnitus can basically, we can release the traffic jam. So the neuromodulation works with the concept of neural plasticity, which means taking advantage of teaching the brain what to do and how to get out of the problem that it has. Again, neuroplasticity, when you hear this word, basically means the brain can still learn. We use neuroplasticity in dealing with traumatic brain injury patients, stroke patients. So we know that it's effective. Synchra basically was the first device which worked with neuromodulation, and it came into USA. And then basically Linear now it's working with neuromodulation. Any person or any clinical doctor who works with any neuromodulation device, we need to make sure that they are trained in it. Again, there are certifications requested in this. Linear has its own certification, which means the provider needs to be trained in it. They are not just letting anybody who does not know about tinnitus jump on their bandwagon, which it's an amazing thing, which means it cannot be mistreated. And basically neuromodulation means we use sound and other stimulations in order to stimulate other areas of the brain. We use musical tones, harmonics, and different pitches, in addition to different senses which get involved in therapy. So the first form of neuromodulation, since the Synchra doesn't exist anymore, and the latest, which is getting a lot of attention and a lot of success, is done by a company, Neuromod, which is off of Dublin, Ireland, and the device is known as Linear. Linear is just got their FDA approval this year, and they have been rolling out, but Neuromod has been basically setting up their infrastructure for the past, I would say, 5 years. A lot of research has gone into it, a lot of development, a lot of infrastructure. It's one of the best tinnitus therapy companies that I have worked with. I've had the pleasure of representing them, working with them. The device shows a lot of success. It's a multi-sensory, that's why we call it a bimodal. It's a neuromodulation stimulation. It has a tongue tip, which basically with 32 electrodes. Basically, I have pictures of it, which you guys can see. So this is the tongue piece. and then it has a headphone associated with it. So again, I need everybody to make sure there is another company which has come up with the same headphone technology, and it is claiming that their device is as successful as Neuromod. So please don't fall for that. Make sure you go to certified people. So the timepiece basically works in unison with, not unison, but in accordance with the Bluetooth headphone. The timepiece has electrical stimulation, which would deliver on the surface of the tongue, and it goes through the trigeminal nerve. And the headphones has tonal presentation, which means sound to the auditory cortex. So as you can see, it's a first of its kind, which is using the neurostimulation, the electrical stimulation of the trigeminal nerve on the tongue, in addition to what the sound is being delivered to the brain. So we are directly stimulating the brain in two different locations, which we are encouraging the brain to let go of the tinnitus, again, by decreasing the overactivity. This is very simply put, and I apologize, I don't want to get into the scientific ways of how it works, but it is successful very much by, I would say, 80, to the point that 83, and I think now it's at 85% of people who are using Neuromod linear, that they are recommending it to somebody else to use. Basically, right now, Neuromod on phase 2. Phase 1 clinicians basically are there. So they didn't come and roll it out to everybody right away, because obviously they wanted to make sure that what the research has been done in their library and scientific advisory can be replicated, but when they roll out clinics. And then once that got evaluated, basically, then we went to the second group of clinicians which are involved. So Neuromod, basically linear.com. If you guys go on the chat, I released it. So by putting the name linear tinnitus therapy, you are going to find all providers which are available in USA right now. So they rolled out, as always, getting the CE approval is much easier than getting the FDA approval, especially approval that they got from FDA is one of a kind. It's not only the one that it says they are safe to use, rather that they actually have delivered results from what they use. The next device, where it's called Levo system. So the Levo system, basically the science was done, and the initial seed funds came from Cedars-Sinai Medical Group. But then during COVID, they went bankrupt. So it was Auto Harmonics. They went bankrupt. They bought out by a Canadian company, and now they're back on the market with the same technology. If I have to criticize them for one thing, is that there hasn't been any changes to what from the time that they got introduced in the market. I think 5. They are using the same technology, same sounds, same everything. It hasn't been any updates to it. But the device works for specific patients. So we do use it in therapy. I do use it for my patients. It's a form of acoustic therapy. So what it does is basically we match the patient's tinnitus. We have the patient listen to their own tinnitus. So we bring tinnitus from subconscious to conscious, actively having the patient deal with the tinnitus by having the patient listen to their own tinnitus. If I have to tell you, again, the device works, but we need to choose the patients very, very diligently. Basically, the way that levo works, it is used at night only. So the patient during the day can use their hearing aids or not use anything, because we can use it with patients who do not have any hearing loss. Linear is the same. We can use it with patients who do not have hearing loss. We can, again, it's a form of acoustic therapy. The device shows that it proves results. How much results, we still don't know. There is no result coming out or published yet. The next one, so actually, let me just show you how it looks like. So they got their FDA clearance. So there is a difference between clearance and approval. Clearance means it's safe to use, pretty much. So their clearance is for people 18 and above. Linear is the same thing. It requires an initial programming. So it's basically an iPod with wired headphones, and that has a software which on the iPod basically presents the tone to the patient. There is initial programming of the device, just like linear, and follow-up programming management is needed, just like linear. VA has approved this device for treatment. Again, I have to say that one thing about every device, they have advantages and disadvantages. The disadvantages about this device is, I believe it has a restocking fee, or last I checked has a restocking fee, which it varies from clinician to clinician. And at the time that I was accepting returns on a wing, we had to show proof that the patient tried and the device did not work. So it's not something that you can jump on it. So the same thing is with linear. I have to tell you, returns are not on these devices because they basically has so much gone into development of the device. The returns are not something which is easy to do. Duality is the new one coming into market. They got their CE clearance. So CE is equivalent to FDA, but Europe. So Duality is basically has named their device Tinnitus G1, and Duality is the name of the mother company. They actually are another device. Again, they are brand new. They just started marketing. They are just entering FDA clearance, I believe, in June or July of this year. I believe Linear got it in January or February. So basically, they are coming up. They don't have a great marketing plan yet, but they are just starting in a few clinics. So the advantage, it's a bone conduction that can be used day and night. It's a broadband tinnitus sound, basically a sound generator. It has an adhesive adapter, which is used behind the ear on the mastoid. This is exactly where you see this person putting it. Because it's a bone conduction, it leaves the ear canal open, and it actually can stimulate both sides at the same time. So it's a great device, I have to tell you. I have been actually renders a lot of results to patients who are suffering from a specific tonal tinnitus. So the sound that it generates, it's a broadband sound. And I have to tell you, one of the best part of this device, it's the most affordable on the market right now. It's a rechargeable, but you have everybody who uses it has to continue to buy the adapter pack, which is the stickers which we use in order to stick it to the head, to the mastoid bone. So I really think that this device has a lot of potential. And the most potential is because of its affordability and because of the fact that it can be used night or day, and because it's used in taking advantage of the bone conduction. Okay, so the newest one, which and it's coming up, it's laser light therapy devices. They use usually the low frequency presentation of laser light. Laser light has been used with great success in other areas of medicine: hair restoration, pain management, a lot of orthopedics. So after orthopedic surgeries, they actually use for stimulation of bone growth. Our friends in I would say beauty industry have been using it for face treatment, facial treatment. So it shows results, and it's the most important part is that it's pain-free. It doesn't cause any pain. And right now we do not have a solid protocol in it yet, but it is showing results. Usually, I would best for laser light therapy, but there are ones who exist. One thing about laser light therapy is you have to either buy a package or per session treatment, again, because it's something as you go. And the negative thing about it is that we do not have a solid protocol. All right, the other things that work about tinnitus, hearing aids that you all know. Hearing aids are not as a therapy for tinnitus, rather because we are helping the patient hear better, we decrease tinnitus perception. So I'm not going to talk about hearing aids because I'm assuming everybody here is very well versed in use of hearing aids. Let's talk about acoustic or sound therapies that we used. So some of the sound therapies that we use, there are companies involved with this, which are very successful. There are ones which are basically on them. So there are some of them who are more controlled, and there are ones which are basically available online and you can use. I would say the best ones that I usually recommend to my patients are the sound of nature. The ones that have implemented some sort of nature sounds are very much more successful because we are, again, go back to cavemen, we all still have a lizard brain, and usually that lizard brain is the part that is effective trying to fight tinnitus perception. And the nature sounds are the sounds that we have it innate in us as relaxing sounds. I hardly find people who hate listening to ocean waves or rain. So I would say if you try to use that, we usually see more results. There I specifically, as a clinician, I do not like notch therapy. I find that in my patients with that previously they have used notch therapy, basically they are overworking that area that is causing the tinnitus perception, both in cochlea and relation to it into auditory cortex, that we are overworking the area rather than underworking it and giving it a relaxation. So personally, I do not like that, but it's an available format. So one of the best acoustic sound therapy ones that I have worked with, it's a company called Sound Pillow. Scott is the owner of that company, and he's a veteran, and I think his device is one of the best devices that I have worked with, especially because he offers a lot of customer service to his device. It's not something that you buy, and if anything goes wrong, you don't know what to do with it. So there are tinnitus maskers, which is available. Tinnitus maskers, basically, I personally call them Band-Aid relief because they are not tinnitus therapy options. Rather, they are distraction techniques. There are ways that we actually tell the brain, don't listen to the tinnitus, instead pay attention to the sound. Basically, what we use them, they are general sounds that we use usually. And a couple of researchers came out that it says people who use general maskers, let us say people who sleep with white band noise during night, are aging their brain a little bit faster than expected. So it's something to think of right now. Again, I do not encourage maskers because they are not a therapy. Then there are alternative treatments, which I strongly recommend. And most of the alternative treatments are based on increasing the blood flow to cochlea, or decreasing inflammation in the body, or changing the chemistry of the body. Because we know chemistry of the body actually has an effect on tinnitus perception. This is how we try to control the tinnitus through medication or through food that the patient is taking. The concept of all these alternative therapies is basically treatment of underlying factors or causations to the tinnitus. So most of the time, if we work with somebody who, like a patient who comes, the audiologist chooses to work with the person, we see fast results. Some examples of all these alternative therapies are craniosacral facial treatment, trigger point therapies, biofeedback, neurofeedback, pulse electromagnetic, which is PMF, TMJ management actually helps with that too. So these are the ones which we encourage the patients to use while they are under care of an audiologist who's a tinnitus specialist. They usually render results much faster when we can actually control and work in unison with therapists who offer all these. So in order to tell you what are the things to do, if you guys want to help in development of more tinnitus therapy devices, like the one that Susan Shore is talking about, I would say you need to start talking about tinnitus. You need to not only complain, rather than heavily get involved in educating people that they don't have to suffer from tinnitus, to continue raising awareness that tinnitus has treatments. And one of the major factors is ATA. We figured as a board that there are areas and there are people who do not know what to do with their tinnitus. And that is what is taking them to the point that, unfortunately, they commit suicide. So we came up with this Tinnitus Advisor program, which is an 800 number that the patient can leave a message, and we have advisors who are all tinnitus certified providers. We take the calls. We take the call, and we usually offer a 15-minute consultation for free. Usually it never takes 15 minutes. I would tell you, I have been on the call with a patient that sometimes for an hour. But usually we can wrap it up within 30 minutes if the patient doesn't have any other adverse reaction or they are not overacting. And we are very, very proud of it. So please share this with people that you know, because again, we do not want to lose people to tinnitus. There is hope and there are things to be done. As you see, the research is coming up. The newest device which we are hoping that comes up is Susan Shore's device. Again, my office is available to anybody who wants to ask any questions. I would prefer that the questions go to my administration. You have my website. Again, I am proud to be a part of this group, and I am proud to tell you that there is hope in tinnitus perception.